I'm passionate about helping all women to breastfeed, but especially our Black and Brown population, getting our babies off to the best start, giving them the best first food, breast milk.
I am passionate about helping families to breastfeed because I genuinely feel as if it is an option that all families should have. Being a mom of two who breastfed as well, I hope to ensure that all families have the breastfeeding support that they need in order to reach their goals of breastfeeding.
I'm currently working with the Mother's Milk Bank of the Western Great Lakes, and I'm an active member of the Chicago Region Breastfeeding Task Force.
I'm passionate about breastfeeding because I believe that every baby has a right to be breastfed if the mother chooses to breastfeed.
Women of color have been leading the community and institutional transformation around breastfeeding support in Chicago for years. To help recognize and support their work, our ISPAN contractor, Dr. Angela Odoms-Young from the University of Illinois at Chicago, invited members of Breastfeed Chicago and the Chicago Regional Breastfeeding Task Force to join the ISPAN Learning Collaboratives, focused on creating action plans to improve continuity of care for breastfeeding support.
Our focus is developing a learning collaborative specifically centered on breastfeeding equity. Breastfeeding equity is critical given the current issues in maternal and child health, both the long-standing infant mortality that people of color face in the United States, as well as maternal mortality, which is an issue in African American women.
So the ISPAN Action Plan helped St. Bernard identify what we needed to give the optimal benefits to a community with low breastfeeding rates, amidst hospital closings, and the lack of breastfeeding resources.
Collaborating with St. Bernard Hospital is affording me the opportunity to meet and support mothers who are considering breastfeeding, moms that already are breastfeeding, and also moms who may not have the information and resources that they need.
Connect with the members of the community, connect with businesses. We can promote breastfeeding in a very important way.
And the ISPAN collaboration gave us the opportunity for the two agencies to come together to establish a milk depot in communities of color, which are underserved and overlooked when it comes to equity in birth and breastfeeding, and we really realized the need for donor milk equity.
This initiative has really been a blessing to me because it has allowed us to partner with both women of color that are working at the grassroots level, as well as traditional community-based organizations that have been doing this work for many years.
Connect the hospitals, connect your community workers, connect with your city workers to try and help mothers breastfeed wherever they are, especially in communities of color.
Through ISPAN, we have hosted multiple learning collaboratives to provide opportunities for peer learning and connection, and to support breastfeeding champions in developing action plans together. Many of these action plans are spurring changes in institutions and communities across the state. So while ISPAN support is just a small drop in the bucket for the work these women have been doing in communities for a long time, we're really excited to be partnering with such inspiring leaders who are really making a difference for families. So we wanted to tell their story and have them tell their story of how a little bit of collective effort can go a long way in impacting families.